Hi, myself Dr. Subhota Choudhury. I am assistant professor from the Department of Pharmacology, Gauri Devi Hospital. Here in this video, I will tell you the mechanism of action of digoxin, a cardiac glycoside. Let's see. Now to understand the mechanism of action of digoxin, first thing you need to understand is the normal mechanism of cardiac tissue contractility. The first, there is calcium channel, so called voltage sensitive L-type calcium current. Now through that voltage sensitive calcium current, calcium enters from outside of the cell to the inside of the cell through voltage sensitive L-type calcium current. Now whenever there is accumulation of calcium within the cell, this calcium causes stimulation of the sarcoplasmic reticulum, also called ryanodine receptor or calcium sarcoplasmic reticulum system. By stimulating the ryanodine receptor, there is release of much more amount of free calcium within the cytoplasm, and this free calcium is responsible for cardiac tissue contractility. Now when the action is over, it will exchange along with sodium. So here is a exchanger called sodium calcium exchanger. In normal condition, sodium comes in within the cell and calcium excreted out from the cell. This is normal mechanism. But what is the mechanism of digoxin? Digoxin causes inhibition of sodium potassium ATPase. Repeat, this is a sodium potassium ATPase channel. Now digoxin is a cardiac glycoside which basically inhibit the sodium potassium ATPase channel. By inhibiting that sodium potassium ATPase channel, there is accumulation of intercellular sodium. I repeat, due to blockage of sodium potassium ATPase channel by digoxin, there is intracellular accumulation of sodium. Now this sodium exchange along with calcium. In normal condition, calcium excreted out, but in presence of digoxin, due to blockage of sodium potassium ATPase and due to accumulation of intracellular calcium, due to accumulation of intracellular sodium, this sodium exchange with calcium, so there is intercellular accumulation of calcium. Now this calcium causes stimulation of voltage sensitive L-type calcium current, thereby there is more entry of calcium within the cell, and this calcium causes stimulation of the sarcoplasmic reticulum and thereby increase the free calcium within the cell. Now this calcium causes cardiac tissue contractility. Again I summarize, whenever you give digoxin, it causes inhibition of sodium potassium ATPase channel. Thereafter there is accumulation of intercellular sodium. Now this sodium exchange along with calcium, so there is intercellular accumulation of calcium. Now this calcium causes stimulation of the voltage sensitive L-type calcium current, thereby there is more entry of calcium, and all those calcium basically stimulate the ryanodine receptor or sarcoplasmic system, thereby increases the intercellular calcium load, and this intercellular calcium load causes increased cardiac tissue contractility. So you see, this is the basic mechanism action of digoxin. This is very important. Thank you for watching the video. If you like my video, then kindly subscribe my channel. And the last thing which I forget, always remember, digoxin toxicity is precipitated by hypokalemia, because in the condition of hypokalemia, digoxin bind well along with sodium potassium ATPase, or in case of hyperkalemia, there is less binding of digoxin with sodium potassium ATPase. So whenever there is hypokalemia and if you prescribe digoxin, then there is chances of precipitation of digoxin toxicity. So in case of hypokalemia, there is chances of digoxin toxicity. Thank you.